Carrier screening refers to the process of identifying individuals looking for pregnancy who would be at risk of transmitting recessive hereditary traces to the offspring. The very vast majority of these patients have no known familiar history of the disorders, unless consanguineous. And because the very vast majority of these conditions are asymptomatic, the carriers will never be aware of their status unless the screening is performed. Historically, carrier screening has been offered for selected conditions to specific populations belonging to specific ethnic backgrounds. And this is still the most used approach in almost every fertility center. In Spain, for example, the board of the Spanish Fertility Society recommends screening for this condition called the cystic fibrosis, which is the most common genetic condition in the Mediterranean area, before proceeding with any gamete donation. And additionally, to rule out the condition called X-fragile syndrome in egg donors. More recently, advances in technology and cost savings has resulted in the introduction of the so-called expanded carrier screening, which essentially means offering to all patients the screening regardless of their ethnic background. This approach encompasses the genetic analysis in a growing number of genes for an increasingly number of rare conditions. At the Instituto Bernabeu, for example, we have available a panel which is able to discriminate over 600 recessive genes. In our opinion, this expanded screening carrier screening program could be a valid option over the standard ethnicity-based program, especially for patients seeking additional information before pursuing conception. The main advantage is that these patients will have the option of doing a pre-implantation genetic diagnosis within the embryo, in the case of being carriers of these recessive traces. Before proceeding with the expanded carrier screening, of course, it's mandatory to have the patient very well informed about the pros and the cons, the benefits, but also the limitations and results interpretation of the technique. We consider this as crucial before embarking on the expanded carrier screening program.